Getting out of a crisis, an emergency, at a national level requires strong, decisive, clear action from federal leaders. We are in a time of crisis with the COVID pandemic. We're a year into it, businesses are still closed, we have a mental health crisis, et cetera, et cetera. This is a time where we need leadership from the federal government. Now, last night in the United States, President Joe Biden gave an address to the American people laying out his plan, some very clear statements on what he was going to do to get the United States out of lockdown and out of the COVID crisis. And similarly, Prime Minister Boris Johnson, as another example, did the same thing a couple of weeks ago. Now, you don't have to agree with everything that they said, but they are the leaders of their country. They are in a time of crisis, and they have put forward a plan for discussion. What I want you to see is the lack of leadership that we have here in Canada and why that is so detrimental to us moving out of a national emergency. Again, the last thing you want to hear out of somebody's mouth during this time is "it's not my job" or "I don't know." So what I'm about to show you is statements from Joe Biden's speech and Boris Johnson's speeches, almost verbatim, against the response of Canada's health minister, the person who Justin Trudeau has appointed to essentially be in charge of taking us through the pandemic. I want you to contrast her answers to the answers that other leaders have given.
Minister, how many members of the Canadian Armed Forces will be mobilized to help provinces administer vaccines in the next 2 months?
Thank you, through the chair, Mr. Speaker. I'll turn to Ian Stewart at the Public Health Agency of Canada to talk about some of the planning underway to support provinces and territories if they need it.
Mr. Chair, a lot of work's underway for planning in that regard, and it's going to be needs-based in effect. It's difficult for me to speak, though, with respect to the plans of the Canadian Armed Forces in supporting provinces. What I can say is the Canadian Armed Forces is supporting us here, and as you know from Major General Fortin's presence, we do have a contingency supporting us here.
So would it be fair to characterize that there are no plans to mobilize any members of the armed forces to administer vaccines at this point?
No, I would not say it would be fair to characterize it as having no plans. I think perhaps it would be appropriate to have the Canadian Armed Forces talk about their support to this initiative.
I just want to know, I'm a minute and a half in, how many members of the armed forces will be deployed or mobilized in the next 2 months to help administer vaccines?
Well, Danny can speak to how many are currently deployed with the Public Health Agency, and then you're asking us to speculate on what will be required.
And we're mobilizing thousands of vaccinators to put the vaccine in one's arm, calling active duty military, FEMA, retired doctors and nurses, administrators, and those to administer the shots.
Minister, how many pharmacies will be administration sites for vaccines by the end of April across Canada?
Well, thank you, Mr. Chair. Through you, I'll say that the provinces and territories are, as you know, as the member knows, responsible for administering vaccines. We work closely with them to ensure that they have the capacity and the supports they need. I'll turn to Major General Danny Fortin to speak about some of the tabletop exercises with the provinces.
That's okay. That's fine. So, Minister, do you have any idea of how many pharmacies will become administration sites for vaccines by the end of April?
I think the member likely realizes that provinces and territories administer vaccines, and of course, we've been supporting the provinces and territories with their planning. I have an official that is actively involved in this planning and would be happy to share more details with you.
I'd be happy to have that plan tabled with committee.
We've made it possible for you to get a vaccine at nearly any one of 10,000 pharmacies across the country.
Minister, do you have, is there any money in the supplementary estimates here to support provinces in setting up administration sites at pharmacies? Or like you're basically saying it's not your wall, right?
Well, no, the member has a habit of putting words in people's mouths. That is not
But
accurate.
the minister has a habit of not answering questions. So I'll go on to the next thing. Are there any plans?
Ms. Garner, I would ask you to let the minister answer questions.
It is my time, and I know the Liberals don't like it when I own my time, but I'm going to keep doing that. Are there any plans to deploy?
When the chair wishes to intervene, it's the chair's time. So I'm not taking this away from your time, but please do let the minister and her officials answer the questions you ask them.
Thank you. Are there any plans, Minister, to deploy federally supported mobile vehicles and pop-up clinics to deliver vaccines?
As I've answered previously, Mr. Chair, there are plans to support provinces and territories should they need supplementary support to vaccinate their citizens.
Are there any plans right now? Like for federally supported mobile vehicles and pop-up clinics to deliver vaccines?
We have planning underway. It's comprehensive. If the member would like to hear about it, we have an official that's actively involved in those.
I have 2 minutes left, about 2.5 minutes.
So the member doesn't wish to hear then the details.
They can table that. They can table that with committee. I was just asking if you had any plans to do that, but I think I've got my answer on that question.
We're also working with governors and mayors in red states and blue states to set up and support nearly 600 federally supported vaccination centers that administers hundreds of thousands of shots per day. You can drive up to a stadium or a large parking lot, get your shot, never leave your car, and drive home in less than an hour. We've been sending vaccines to hundreds of community health centers all across America, located in underserved areas. And we've been deploying, and we will deploy more mobile vehicles and pop-up clinics to meet you where you live so those who are least able to get the vaccine are able to get it.
Does the federal government have any plans to set up websites, et cetera, to help people get appointments for vaccines?
Again, the member perhaps doesn't realize that it is in fact provinces and territories that have the right and the responsibility to administer health care, including vaccination.
Okay, so there's no plans from the federal government to assist in that.
At the time when every adult is eligible in May, we will launch with our partners new tools to make it easier for you to find the vaccine and where to get the shot, including a new website that will help you first find the place to get vaccinated and the one nearest you.
What percentage of people over the age of 65 have received a dose of a vaccine to date?
Perhaps I can turn to my officials for the percentage of people that have received doses. We may have some of that information. Ian, would you like to speak about the province's progress?
I've got a minute and a half left. You don't have that off the top of your head, hey, Minister?
Let me be clear. We have a ream of data on vaccination, on the planning of provinces and territories.
You came here to
more than happy, I'm more than happy to provide that information through the appropriate officials and agencies. And so, if you would allow them to have a moment to answer,
You're the minister, and I asked you, and you don't have it. So, with the time I have left, I'd be happy if somebody would table that with committee. You can't answer that question at your fingertips, and it's kind of a big question.
When I took office 50 days ago, only 8% of Americans, after months, only 8% of those over the age of 65 had gotten their first vaccination. Today, that number is 65%.
My last question, Minister. Do you agree with this statement? Even if we sustain lockdown indefinitely, which would cost lives and do immeasurable harm to our children, we would not be able to eradicate this disease, referring to COVID-19.
I'll turn to Dr. Tam to talk about the most recent research.
Yes, Mr. Chair, the coronavirus is found in every country and territory around the world, so it's unlikely to disappear from the global population for some time. And science is evolving, but that is
Minister, would you care to answer if you would agree with that statement or not?
I trust the expertise. I have a top-notch virologist as the Chief Public Health Officer, and I trust her perspective. She is far more eminent in this area than I am.
Thank you, Chair.
Even if we sustain the lockdown indefinitely, which would itself cost lives and do immeasurable harm to our children, we would not be able to eradicate this disease?
So just to give you some context, what the minister was appearing before committee with me for was she was asking for hundreds of millions of dollars of federal spending to ostensibly get Canada out of a time of crisis. But when I asked her basic questions about what she thought she should be doing as a leader of our country during that period of time, she either said, "It's not my job," or "I don't know." And you know what? That doesn't cut it. When we're in an emergency, it's all hands on deck. You don't look at bureaucracy. You don't look at reasons to say it's not my job or I don't know. You should be looking for ways to fix it. And that's the key problem that we have here in Canada right now, is that the federal government really has taken almost no leadership. They've put the provinces behind in terms of getting them vaccines to deliver. And then they're going, oh, not my job. I don't think I'm going to help out here. Now, to my colleagues in provincial governments who are working hard, provincial healthcare workers who are on the front line, you guys are doing your best. I get that. But for the federal government, for the health minister of Canada to sit in front of a committee and ask for hundreds of millions of dollars and not be able to say, like, look, you know what? I reached out to the provinces. This is where British Columbia needs help. This is where Ontario needs help. This is how we're going to help doing this. And this is how that money is going to be used in that period. Like, that should be the type of response, right? Not a, an Ottawa knows best response, but like hey, like, I get it. Like, kind of part of my job. And that's why Justin Trudeau has failed Canadians so much. He looks at this as a political exercise. He's trying to defer responsibility as much as possible. And that's left us with virtually no vaccines in terms of where other countries are around the world right now, and more. So I wanted you to see that. I literally took quotes out of Biden and Boris Johnson's speeches. I'm like this is what I'm confronted with as an opposition member in Canada every day, is this lack of understanding that this is a national emergency and a lack of leadership from the Justin Trudeau Liberals, including the health minister, who, I'll close with this. I have been in cabinet, and public servants, they work hard, but at the end of the day, your job as a minister is to ensure that the needs of the people, the political mandate that you have, are being met by those public servants. You'll notice the health minister, she always well, it's really not my job. I'm just I don't know. And it really, at that point, it's why are we paying your salary? To quote that old movie Office Space, what is it exactly that you would say you would do here? Enough is enough. We need hope, we need a way out, and for that we need clear, decisive leadership. And we sure aren't getting it from Justin Trudeau. I'm going to get back on committee and keep grilling her. Working hard for you. Have a great day.